Hello everyone, welcome to Gray Matter, your soon-to-be one-stop shop for all your exam preparation needs. This is going to be another video in the UKMLA Roadmap series where we walk you through the MLA Content Map, which is a document prepared by the GMC containing all the topics that they could test you on, whether you sit for the UKMLA exams or the PLAB exams. Now, IMGs are international medical graduates who have their PLAB exams booked, got an email from the GMC saying that after the 17th of May 2024, whether you sit for your PLAB 1 or PLAB 2, your exam will be created using the MLA content map instead of the previously used document, which was the PLAB blueprint. So IMGs, keep your ears peeled because I'm going to be telling you stuff that was tested previously and stuff that wasn't tested previously and may show up now in your exams. And UKMLA candidates, of course, you want to take a look at this video and this MLA content map because, of course, all these topics are important for your exam as well. Now, cardiovascular system. This is what we're going to be discussing today. And all the MLA topics are laid out in this way where you have the topic and then you have the conditions and you have the presentation. So we're going to go through the conditions real quick. Acute coronary syndromes, right? You've got your angina, you've got your unstable angina. All this has been tested previously, has shown up previously in the PLAB exams. It has been extensively tested, I'm sure, in your medical school years. This is very important, always shows up on exams. Prepare this well. Next, you have acute limb ischemia and occlusions. This has previously shown up in the PLAB exams as an emergency scenario where a patient has acute limb ischemia, may have atrial fibrillation, and that atrial fibrillation might have led to thrombosis, arterial thrombosis, right here, and might have led to a cold, painful, pale, pulseless leg or foot. So this is how this usually shows up and has shown up in the past as well. Prepare this well. And then we have aneurysm. So this is new, okay? Aneurysms and aortic aneurysm. This is something we haven't seen as commonly or at all in the past in the PLAB exam or the PLAB 2 exam. Make sure you prepare yourself well. Learn how to examine the abdomen for aortic aneurysm. Look at videos, a pulsatile mass in the abdomen, and how to palpate for this. This will probably show up as a combined station. What that means is you'll probably have a mannequin or a patient, and you'll have to actually perform an abdominal examination on them and figure out that they have an aortic aneurysm. Okay. Next, you have aortic dissection. This has also not shown up in the past. This you should prepare very well. Aortic dissection may show up as acute abdominal pain radiating to the back, and you need to know how to manage this and how to take care of this patient. Okay, well, this patient will probably show up as an emergency scenario or a Simon scenario as well. Okay, next you have aortic valve disease. Aortic valve disease hasn't shown up as extensively in the PLAB 2 exam, I don't think. So make sure you know the murmur of aortic valve disease. Okay, so you know, ejection systolic murmur and how you're going to manage the patient. If you're confused about any topic, what you can do is you can Google that topic, write aortic valve disease or aortic stenosis or aortic regurgitation, and then write NICE CKS guidelines, and you can open up the website and see the guidelines, or you can write NHS, and the NHS will probably have all the information about this topic, okay? So make sure you prepare yourselves well. This is newer for PLAB candidates. Next, we have arrhythmias. Arrhythmias have shown up in the past. Arrhythmias may show up as blackouts and faints, right? Syncope, that's how arrhythmia may show up. And arrhythmia may also show up as dizziness maybe. Not so much dizziness, more so in blackouts and faints. It may show up in ischemic limb and occlusions because you may have atrial fibrillation leading to thrombosis. Arrhythmia may show up as SVT or supraventricular tachycardia in an emergency scenario, or it may show up as a patient who doesn't have arrhythmia when they visit you, but they do have racing of the heart or palpitations when they go home. So you need to do Holter monitoring or ECG monitoring or whatever. So this has shown up in the past. So PLAB 2 candidates should be well prepared when it comes to this topic. Next, you have arterial ulcers. This has not shown up in the PLAB2 as extensively. This is something you could say that's newer, so make sure you learn how to examine arterial ulcers, how to recognize arterial ulcers, take a look at pictures, make sure you take a look at how to examine this and how to diagnose this and how to manage this, okay? Next you have, and why this happens, okay? And then you have cardiac arrest. This hasn't shown up as commonly, but I wouldn't say that it's new necessarily. Just make sure you know how to do basic life support, right? And how to deal with a patient with cardiac arrest. Next, cardiac failure. This has shown up in the past. A patient may need to start medication related to cardiac failure. You may get an emergency scenario. So this has shown up in the past for PLAB2 candidates, and this has shown up very commonly as well. So of course, prepare this well. Deep vein thrombosis usually shows up as a patient who has had a long flight or has had previous surgery. You need to, or a patient who has been taking COCPs or combined oral contraceptive pills. So yeah, this has shown up in the past extensively, has also shown up with pulmonary embolism as well. So make sure you know how to examine this patient, make sure you know how to manage this patient. May show up in a plethora of scenarios or stations. Okay, so do this well. Next, you have essential or secondary hypertension. This usually shows up as a patient who has been diagnosed, has their investigations, and you have to advise them. You have to tell them lifestyle changes and tell them about diet and exercise and their medications. Next, you have gangrene. This hasn't shown up in the past as much. Make sure you prepare this well. Make sure you know how to examine a patient of gangrene. Make sure you know how to counsel a patient for limb amputation as well, because that may be a part of a gangrene station. Next, you have hemochromatosis. Also has not shown up in the past as much. Make sure you know why this happens and how to manage this patient. Next, you have infective endocarditis. This has, I would argue, shown up in the past with dental surgeries or homeless patients, IV drug abusers. Yeah, so this has shown up in the past in PLAB2 exams. Just make sure you prepare this well. Next, you have intestinal ischemia. This, I wouldn't say was that common, but I would argue that this has shown up as well in the past. This may be an emergency scenario, may show up with acute abdominal pain, right? Next, you have ischemic heart disease. Of course, myocardial infarction, a favorite topic all the time. So, of course, prepare this well. This will probably show up in your exam. Next, you have mitral valve disease, not as extensively tested, similar to aortic valve disease, so I'd say prepare this well, know the mitral regurgitation murmur, know the mitral stenosis murmur. This may actually show up as a cardiac failure scenario where there's mitral valve disease and then that leads to cardiac failure, and that's an emergency scenario. So I'd say it has shown up in that way in PLAB2 exams, but make sure you go a little deeper into this. Next, you have myocarditis. This has not shown up in the past, I would say, so make sure you prepare yourself well. Pericardial disease has shown up in the past. Younger patients, right, with chest pain, a fever, with a previous history of a flu-like illness, right? So this has shown up, and you give the patient NSAIDs, and later on, maybe if it gets worse, you give the patient steroids. But yeah, this has been a part of PLAB2 exam in the past, okay? Next, you have peripheral vascular disease. I would say this has shown up in DVT, arterial thrombosis, that kind of thing. So yeah, this has shown up in the past, I would say. Pulmonary embolism, right? Chest pain, breathlessness, right here, breathing difficulty, right? With deep vein thrombosis, with a history of a long flight, right? You do get pulmonary embolism. So this has shown up. It is important. You need to know how to anticoagulate the patient. This may also be an emergency scenario, so a SIMMEN scenario. Next thing is pulmonary hypertension. Pulmonary hypertension has not shown up, I would say, as much in the past, so make sure you prepare this well. Right heart valve disease. Again, valvular diseases haven't shown up as much in the past. Make sure you prepare these well. Strokes have always been a part of OSCE exams or even MCQ exams. So, stroke has shown up. Who hasn't seen stroke in their exams? Prepare this well. Transient ischemic attacks, again, have shown up. Mainly, they want to see you advise the patient about driving, right? DVLA, very important part of it. And next you have vasovagal syncope, right? Blackouts, faints, right? Maybe postural hypotension, maybe part of arrhythmia, maybe, hemophobia, so phobia of blood, phobia of needles, whatever. So vasovagal syncope. Usually this patient is just fine, you just have to counsel them. Next you have venous ulcers. Make sure you learn how to examine these patients and how to manage these patients. So we talked about acute abdominal pain, dissection, intestinal ischemia. You've got your acute change in or loss of vision, right? This may be part of transient ischemic attack, CRVO, central retinal artery occlusion, central retinal vein occlusion. You've got your blackouts and faints with vasovagal syncope or arrhythmias, or even myocardial infarction, or even strokes. You've got your breathlessness, pulmonary embolism, myocardial infarction, not pericarditis, I would say, more so in pulmonary embolism, maybe in cardiac tamponade after aortic dissection. You've got your cardiopulmonary, cardiorespiratory arrest, right? BLS, CPR, that kind of thing. Chest pain, of course, is a part of cardiovascular. This has always been a part of cardiovascular. Next, you have cough, right? This may show up as a side effect of a hypertensive medication like ACE inhibitors, or it may be a part of arrhythmias as well. So yeah, or even pneumonia. So yeah, make sure you pay attention to cough as a presenting complaint. Next, you have cyanosis, so Raynaud phenomenon, some kind of vascular disease. Next, you have dizziness, arrhythmias, right? Or even myocardial infarction. Next, you have erectile dysfunction. So this is very important, where you may prescribe a patient GTN or glycerol trinitrate, and you need to advise them on Viagra and GTN usage together. This has shown up in the past. Fever, pericarditis, right? Maybe a part of pericarditis, maybe a part of endocarditis. So yeah, maybe a part of valvular diseases where you get endocarditis. Heart murmurs, very important. I would say this wasn't a big part of PLAB2, did show up, but wasn't a big part of it. So make sure you prepare this a little more than usual. Next, you have hypertension. So you may have to advise a patient, counsel a patient, tell them about their medication, or even diagnose them for the first time. Next, you have limb claudication, maybe a part of DVT, limb weakness. You've got your arterial thrombosis, you've got your ischemic limb, you've got your stroke. Next, you got low blood pressure, maybe orthostatic hypotension, maybe postural hypotension, right? Or vasovagal syncope. Next, you have pain on inspiration, okay? Remember that in pericarditis, you may actually get this kind of pain. Next, you have painful swollen leg. Again, we've talked about this ad nauseum in ischemic limb. Next, you have palpitations, arrhythmias, right? Next, you have peripheral edema and ankle swelling. This may be part of calcium channel blockers as an antihypertensive medication, maybe a part of heart failure. Next, you have pregnancy risk assessment, okay? You need to make sure that you know how to assess the risk of cardiovascular diseases in a pregnant woman. Next, you have skin ulcers. This is new. So for PLAB candidates, I'd say pay attention to this, learn how to examine these patients. And then you have wheeze, of course, as a part of, you could say, the cardiorespiratory system, okay? So there you go. Those are the topics. And for PLAB candidates, I told you the new stuff. For UKMLA candidates, I just gave you a quick rundown. In the next video, we'll talk about PEDS. Stay tuned and make sure you keep your MLA content map PDF with you during your preparation. Thanks for watching. See you next time.